I am Dr. Jeffrey Sterling, Surgeon General for Alpha Phi Alpha Fraternity Incorporated. This Surgeon General Initiative health vlog is on traumatic brain injuries and what happens after a concussion. So your son is a star in Friday Night Lights, actually football, not the TV show, and has been concussed. Amazingly, the most common question I get asked is not will he be okay, but when will he be able to get back on the field? My answer, when I see them in the emergency department, is never going to be less than 2 weeks, and I won't be the one who provides medical clearance, and neither should anyone associated with your high school unless they're a physician. It will either be your family doctor or preferably a neurologist. Don't just take my word for it. Consider the following quick tips from the Center for Disease Control and Prevention's discharge instructions. If you've had a concussion, you may experience a range of symptoms over the next few days, such as difficulty concentrating, dizziness, or trouble falling asleep. These symptoms can be part of the normal healing process, and most symptoms go away over time without any treatment. You will be instructed to return immediately to the emergency department if you have worsening or severe headache, loss of consciousness, increased vomiting, increasing confusion, the presence of seizures, numbness, or any symptom that concerns you, your family, or friends. Before anything happens, be sure to tell a family member or friend about the head injury and ask them to help you monitor for more serious symptoms. Odds are they'll know if you're acting different. You should get plenty of sleep and rest and return gradually and slowly to your usual routines. During this time, you should not drink alcohol, and you should avoid activities that are either physically demanding or require a lot of concentration. If you don't feel better after a week, you should get a repeat appointment with a physician who has experience treating brain injuries. Importantly, you should not return to sports activities before speaking with your physician. A repeat blow to your head before your brain has had time to heal can be very dangerous and may slow the overall recovery or increase the chance for long-term problems. There are two consequences to concussions about which you should be aware. The second impact syndrome is irreversible brain injury triggered by a fairly routine second head impact after a prior concussion. This is why it's so important for you to take the time off needed for the brain to heal after initial concussion. We care more about your child's mental future than any upcoming sports activity. The post-concussive syndrome is the second concussive consequence of note. It represents long-term neurologic and psychologic consequences of the head injury. It includes such symptoms as the inability to sleep, irritability, inability to concentrate, headache, dizziness, and anxiety. There are no definitive treatments for concussions other than the prevention of an additional injury. That fact should be chilling to you. Be mindful of the risk involved in choosing to engage in activities that put the brain at risk. Here are red flags for you to be concerned about: a worsening headache, repeat vomiting, slurred speech or difficulty with expression, seizures, children who won't stop crying and can't be consoled, children who won't nurse or eat. Look for additional content on Sphinx TV that discusses steps you can take that will assist you in your health journey. I'm Dr. Jeffrey Sterling. Thank you for watching this Alpha Phi Alpha Surgeon General Initiative video blog.